I'm Candace Thompson. I'm a breast surgeon in the Bay Area, and I'm the co-host of the Pink Table Talk. I'm really excited for today's topic. Haley, I guess you want to introduce yourself?
Sure. Hi, everybody. I'm Haley Pollock. I am the executive director of Bright Spot Network, which I'll share more about in a few minutes.
And I'm Lucretia Burns. I am a mom with the Bright Spot Network who is kind of finishing up her breast cancer treatment and entering into early survivorship.
We love to hear it. Um, so to just like ground us in the work, Pink Table Talk is a conversation about Black breast health, a conversation about also Black breast cancer, of course. It is a space for us to really talk about all the unique things that come along with cancer and breast health. And it's found it will really we try to reach young Black women, right? Because it's so really important that they understand their risk for breast cancer. Black women under 35 are getting breast cancer 2 times the rate and dying at 3 times the rate. And so it is just incredibly important to raise awareness about Black breast cancer and Black breast health and what we can be doing about it. And I think this conversation came about because it was Mother's Day this month. It was my first official Mother's Day. I feel like last year my mom did give me gifts preemptively for Mother's Day, which I didn't need, but this year was my first official one, so that's exciting. And we wanted to really bring some mothers into the conversation so we could understand what survivorship looks like with motherhood, right? And so um, I think first, let us dive in. Lakria would love to hear your story, hear who you are, and learn all about you.
Okay, so I am a breast cancer survivor. I was diagnosed in October of 2024, October 15th. I'll never forget that date. Um, my story began with motherhood, which I'm finding a lot of women in our support group having a similar connection to breast cancer is breastfeeding. So I was nursing my son. I had my son in 2022. I was 40. God bless me. And after years of infertility, I hear a lot of women speaking about that as a connector of breast cancer as well. I was having trouble getting my milk to dry up. So 8 months of leaking, pain, not breastfeeding, not pumping. I'm like, guys, what is going on? And I had a doctor who was relentless and said, let's do a mammogram. First mammogram in 2023 came back clear. And she said, let's do another one in 2024. And that one came back positive. Um, at diagnosis, I was stage 1A. And, you make lots of decisions because you're a mom. I didn't want to do chemo first. I wanted to do surgery, then chemo. My doctors were thinking there was a lymph node that was shaped kind of funny, and they weren't sure if we should start with chemo or surgery. And I pushed because we all have seen what chemo does. Um, and within 45 days, waiting to get into the OR, that lymph node that was negative at biopsy became positive. So I did all of my treatment as breast cancer stage 2A, HER2 positive, with grade 3 and a very high proliferation rate. So my treatment consisted of 6 rounds of chemo, 17 rounds of HER2 treatment or Herceptin Perjeta, and 33 rounds of radiation and a lumpectomy that changed my parenting completely. My son and I were co-sleeping up until the day before my surgery. So, Bright Spot, I found Bright Spot really early on in the process. And really quickly, they taught me not to hide it from my 2 year old, who I was just imagining like, he's just going to miss this whole thing. We just keep it from him. We just deal with it in silence. And Bright Spot is like, no, they will know. they will feel that something is off. And that was spot on for my son, who was very perceptive, and very rambunctious. It changed how I reacted to treatment choices because I'm like, I got a 2-year-old son who is rambunctious. I didn't want to do a double mastectomy because I didn't want him to pull my drains out. We had been co-sleeping up until the day before my surgery. So I opted for the lumpectomy. And, we were able to get to no evidence of disease with all of that treatment, but that treatment leaves a wake of other illnesses in its path. And so, in my experience, I've had to navigate, of course, hair loss. Thank you for my curls coming back. But Bright Spot sent us books to read with our little ones. And my favorite book was Stickers for Mommy's Bald Head, because it literally made me being bald fun for him. He wasn't there when I did the first like mini haircut, but he was there when I did the buzz, and I was crying, and he rubbed my head and told me it was all right. And he even laughed and sang songs about mommy's bald head, because we had been reading about it. I knew it was coming. And the other book that helped me navigate lots of fatigue, lots of, I'll call it digestive issues, just lots of bad days, was the book called The Adventure Jar. I talk about that book to anybody who's a new mom or new to the cancer journey. It taught me that even on my bad days, I could create activities or I could create connections with my kid. And the first thing I did, and this was literally during my surgery, recovery, I said, you know what? Keep the door open. Because that very first day I came home from the hospital, my family's like, no, you can't be around mommy because, I had a port installed. So this whole side, and there's a catheter in your neck. So you're like, this side's all messed up. And then I had the lymph nodes removed plus the lumpectomy. So I felt like I could barely do anything. And so my family immediately thought, keep him away. And he had a violent reaction to that, right? We were cold sleeping up until the day before surgery. He had a really hard time with that. And I read The Adventure Jar, and I realized all I had to do was leave the door open. He would come to my bed. He would see that I was tired or hurting. He would give kisses or he would tell me something funny, but he immediately realized that he couldn't go as far as he used to. And so leaving the door open, it would be hard for me because I'd hear him out there just living his best life without me. And I'm like, oh, is this what it's going to be like? And it wasn't, because of that door being open. We had movie nights. We played on mommy's bed. We did the possibilities are endless of spaces that you can create. And even when I was having lots of GI issues, he would just come stand in the bathroom with me. And at first, you have to be really careful because the chemo is very toxic when it's coming out of your body. But
Mm.
after a while, when I taught him, like, no, don't touch mommy, don't touch, I started to look forward to that experience, because you can sometimes be in there 45 minutes. This is chemo, it's tough. But that definitely gave me little bright spots. So there's a lot more to my story, but I'll stop. Oh, and my last treatment was December 23rd. And so that was our Christmas gift, was mommy was done with treatment, but the bone pain, Herceptin Perjeta. So it just changed how I could move. And that's a story for another time, but that's how I found the YMCA Live Strong program. They helped me after treatment to recover. So that's me in a nutshell.
Thank you so much for sharing. I mean, I'm like, so many thoughts are coming to mind about your story. And I'm sure I saw Dr. Candace's face at times too about your treatment plan and like, like it's and how you made your choices, because it is about shared decision making, and you're sharing that with a 2-year-old who like doesn't know, but you have to like considering him, right? But it's funny because
Yeah.
we give out bags at all of our events, right? We give out these little gold bags or a Love of My Girls bag. It's how we disseminate our materials. But recently we were like, we got to get rid of the bags. We got to do something new and fresh, right? And so I was like, I texted my mom and I was like, what does everybody use every day? And she was like, toilet paper. So we like for
Absolutely.
the second floated the idea of doing like a branded toilet paper, which like we're not doing, but it's just funny because like it would be useful. People are in the
That's
bathroom using.
It's funny that you mentioned that, but I
that's
remember there
awesome.
was a moment where I said, you know what, I've got to make my bathroom a better
A thing.
space
Yeah. How do we make
because
that space a
mentally
place?
it was. And so, like, I did things in my bathroom to make it pretty and inviting. Like, I got really pretty
Mhm.
bath mats. I got like little
Good.
pictures on the wall. My family and friends got me little cancer sayings like "You picked the wrong girl," because
Mhm.
that bathroom becomes really important. So I don't know. You might not be too far off.
Right? We were like, should we? No, but no, I think it's really interesting to hear how, like, for example, like not wanting to have the drains pulled out because you have a 2-year old and how that changed your decision, right? Or had an
Absolutely.
effect on how you would make that choice.
Mhm.
And so that's interesting. Dr. Candace, what did you think about her treatment journey? And
Yes, thank you so much, Lakria, for sharing your treatment. I think it really shows how it's important to have shared decision making with your provider and your care team, and to be comfortable enough to be able to express your desires and have the treatment tailored to you. I think this is really important because we do have higher rates of breast cancer in younger women. Breast cancer in women under 45 accounts for 10% of breast cancers are in women under 45. And you also mentioned infertility.
Mhm.
Um, and I mean, there is a smaller correlation between delay to pregnancy and breastfeeding and breast cancer. It's not a significant increase, meaning like it's not the cause necessarily, but
Yeah.
that can slightly increase one's risk of developing breast cancer. And with this increase in people who are getting breast cancer at younger ages, I see a lot of patients who have really young children and are recently diagnosed with breast cancer and have to have surgery as well. Um, and we always have to undergo the talk about like chemotherapy first versus surgery, especially for HER2 positive or triple
Mhm.
negative or aggressive ER positive disease.
Mhm.
So that's also an important conversation that we can talk about that in a little bit if you want to.
Yeah.
But I think first we should probably get more into the bright spot and what you all can provide for women such as Lakria who are in this situation who have a new diagnosis of breast cancer and little ones and are trying to juggle just being a mom at baseline. And now there's this diagnosis of cancer.
Yeah.
yeah, to my fellow Haley.
Yes. I love being on a call with two Haleys. That's amazing. And your little one, Jetson's just sleeping now.
Yes,
I mean,
she's
I
not
shouldn't say
knocked
it now.
out.
It's gonna,
No,
I
no,
want to
you're
jinx
good. You're good.
it. Yeah, so thank you guys so much for having me and to be able to share about Bright Spot is so special. So I was diagnosed with colon cancer when I had an infant. I had a 6 month old and a 3 year old. And at the time, I wasn't able to find any resources for me as a new mom and as a cancer patient. And kind of like, long story short, after I was done with treatment or during my treatment, I met another mom who was diagnosed with breast cancer when she was pregnant and had a 4 year old. So our kids were ended up kind of being about the same age, and we connected about all of the things, but especially about being parents and how to navigate parenthood. And just like exactly like Lakria, like I had a 3 year old, and people were like, "Oh, like they won't remember. Don't even worry about it. It's fine." And just like your son, my daughter was curious and perceptive and it just gut check, it didn't seem right to not say anything to her about it. There was more tear. I was crying all the time. There was just changes to the routine, all these things. And so I talked to her about my cancer, but me and Amy, my co-founder of Bright Spot Network, so much of what we connected about was how do we walk our kids through this? And through that experience, we started Bright Spot together to support families that are navigating a cancer diagnosis while they're raising kids 0 to 10. And we are really focused on those younger ages, like 0 to 6 is really like our bread and butter. And we offer a number of different programs from support groups like Lacria mentioned. We have a support group for parents in active treatment, stage 4 parents, partners. We have a survivorship group, and we have a group for parents of color. And so, in addition to support groups, we have a free book program where we'll send books straight to your home. You can choose 2 free books online. We'll send books straight to your home alongside discussion guides that can help you just use those books to help talk to your kids. And if you're a parent, you read that same book over and over and over again. And with these cancer books, it kind of allows you to kind of have new conversations. And these discussion guides are there to also help you, create activities, just like Lacrio was saying with the stickers and all of that. We have a box that we'll send to your home that has an art project inside, nothing cancery in it. It's just a place to connect to your kid when so much is going on. You don't have to go to Target. You don't have to go to you don't have to get anything. Everything is included. We have a bunch of webinars and educational opportunities for folks to engage in. We have a financial assistance grant, and so much more, actually. Find everything out on our website at brightspotnetwork.org. But yeah, that's kind of the short of it. I'm happy to talk more about some of the other programs.
Well, I love hearing about all the books. I was an elementary school teacher before I came into this job. And so, like, reading books and doing all that is my jam. I actually want to, like, send you some other books
Yeah,
that I guess
please.
you might not know, you might have them. But Lakria, you also mentioned the Adventure Jar, which some of our, supporters from Gilead were sharing that book with us as well. Somebody literally texted me yesterday asking if I had a copy of that book for something they were doing. So it's just funny that you just mentioned it, because I think that's such a great resource for young kiddos to be able to know. And I think what's so cool of what you guys do and what you value is like beginning this moment where you start to talk about your health with your family. Right.
Mhm.
I think that's so important. It's a large part of our Love of My Girls campaign is like, know your family history, understand your risk. Like, and so what you're doing is starting this process and this thing from ages 0 to 6 so that kids know to talk about their health. It becomes a regular thing that we discuss mommy's time in the bathroom. We discuss, all of these things because those are all real. Moments of survivorship and you are addressing them at that age, and that's again just it's going to allow all of these kids that are affected by bright spot to be able to like just clue into their health a lot earlier. I think I mean I hope, right, that like that's I think that's like a trade-off that's going to happen because they're going to be like, oh, I do know that my mom is this when they're at doctor appointments. They're going to know how to talk to doctors. They're going to know how to like have these conversations, and ultimately, hopefully, when they're also like hitting puberty, they're like, oh, I know breast health, like I know these things. Like this is not weird. And so I'm excited for the generation of youth that you guys are preparing to be able to tackle their health and be more in the know, you know?
Yeah, I completely agree. This is a conversation that's needed that's not even taught really in school. Even though there are younger people being diagnosed with breast cancer every day, I have multiple patients who are in their early 20s with breast cancer that um, have to go through treatment. So I think it's great that you have this program and that you're providing books. Haley, this reminds me of we had another person um, on our show several years ago, Ashley Dedmont.
Ashley
Oh
Deadman, do you know
yeah.
her?
Uh-huh. Yeah, yeah,
She
Yeah.
yeah.
has
And she has
she
her
has a
book. Yeah, yeah,
great
yeah.
book.
Totally. She has a
Yeah.
great book. Totally, totally.
Um, I think There are a lot of different books that are available to families going through this cancer journey and sort of explaining like the whole puzzle to even like the parents or the person with
Hmm.
cancer. It's like there's so many different people who you have to see, all of the ologists.
Yeah, yeah. Well, and I think it's so important to remember that, like, for these little kids, if you're not talking to them, they're making their own story up in their head. And,
Mm,
especially like, like Lucretia, like, like if you have like I mean, whatever, all kids, but like if you have like a special kid, like, like we had, but like these kids are like, they're making up their own stories if you don't tell them what's going on. They might blame themselves. They might think it's worse than it is. And so to just bring them in and have the conversation, and Haley, to your point, just like to kind of normalize the doctors, to help them understand somebody else might be coming to pick them up after, school or preschool. There might be different people, but we have doctors, and maybe you even are able to show a picture of your doctor to help them. This is the person that's helping me. I have a great team. It's comprised of surgeons, like all these different, like all of that helps to normalize the whole process, and is going to allow them to feel more comfortable to ask you the questions that maybe they have now about your cancer, but maybe they have later about something totally different. It's all a part of just, being on a journey as a family together, in the end. So, yeah.
I'll
that's
share
cool
a
too.
funny.
Yeah, go, go, go.
I'll just share a funny story. My mother was in the hospital recently. She's out. She's okay. But my son went up there to visit her. He was completely comfortable in the hospital room. He asked her if he could check her breasts.
That's
So I
hilarious.
now have to kind of
I love
explain to him
that.
there are different
I'm
types
dead.
of illnesses, but he
That's
sometimes
too
jokes and
funny.
calls himself Dr. Rashad. And so that gives me a lot of joy. But when you talk about the next generation of people who have to be advocates for
Mhm.
their health,
Mhm.
who have to be unafraid to research things that they've never heard. Like, I remember there was one book, I can't think of the name of it, but it talked about cancer in like a really specific kid friendly way. And I'll be honest, my mother needed that book too,
Mhm.
because it talked about like, okay, what actually is cancer? Why do you need both surgery, radiation,
Mhm.
chemo, all of the
Yeah.
things? And so there was an education overhaul for my entire family, from my son all the way up. And sometimes those children's books
Mhm.
made it where people could actually get comfortable with, okay, this is why they're doing all of this to my child. Because, my mom is looking at, she's parenting me through, cancer. And my father in 2020 died from prostate cancer. And so it's definitely a generational shift in our family of being medically um,
Educated.
educated and sharing in that education
That's so
from the bottom
exciting.
up. Yeah.
That's like a whole new layer of it, right? Or a whole different tier of what this, because it's like people, the average person is at a fifth grade reading level, right? And so being able to, and like there are doctors in certain fields who still aren't well versed in other fields, like there's so much room to learn about. About the
Mhm.
medical terminology and the things. And so that's really, really cool that accessing, or like in an effort to talk to your kids, you've also informed everyone, right? Because it was language that everyone could understand. Right. I think that's what we try to do at Touch, right? As we talk about, we will do a lot of work with clinical research. So we try to explain things, and my mom always says words that people can spell, right? Because that
Mhm.
means that they're going to actually be able to access this information. And so I think that's really, really cool. And then also the fact that you're probably like your son playing doctor, you're probably like really inspiring careers here in a
I
really
hope
fun
so.
way, because right. No, I mean
I
that
would
that's
not be
really cool
mad.
too, because you like even in schools today, you're still taught teacher, doctor, this, but like they're learning like radiologist, oncologist,
Mhm.
nurse, like all the people that are a part of this journey, which is
Yeah.
really, really, really cool to think about how you might be also just inspiring learning in general,
Agree.
right? You're now making it a thing that we learn about. I always like, as a teacher, I always just said, read everything, every
Mhm.
sign you pass, every, like that's the most effective readers are like, or the best readers are just like, they're reading the street signs, they're reading the things, the signs in the grocery store, they're like taking it all in. So I think you've accessed another space where your son is just going to have this wealth of knowledge because he i- is actively learning all of the time, which is really cool.
And that empathy. I mean, to go to your, to his grandma and like, to like, just
Like,
be like, I'm like, like, can I help? Like,
yes.
it's so beautiful. Like, I don't
Yeah.
know. I feel like there's also just that empathy that, of course we don't want anybody to have cancer, but like I hear from parents all the time, who are a little bit on the other side or, and just the way that their kids respond to other kids or to other people's illness, they learn a tremendous empathy when they're on this
Mhm.
journey with a parent.
Yeah, for sure.
Yeah. And then the advocacy component as well, like advocating for both himself as well as his grandmother
Awesome.
is amazing. So I love that.
Yeah, you'll hear him saying, I need to go to the doctor. I'm hurt. So I hope that this does create another Black man who is going to go to the doctor early and often, because it is now like base for my family. Because, my breast cancer was invasive ductal carcinoma. And, the way that I've explained it and simplified it for my family is when the cancer is in the duct, it's harder to detect than when I call it bursts through the duct. And by me having that baseline mammogram in 2023, it was like the tiniest little speck in 2024. You could not feel it from the outside. I was having pain in my nipples. My son we talk about all the terminologies we use: breast, we use nipples, and all the things. And had I not gone over and over, it could have been years before it was detected. It could have been a lot more mobile before we started treatment. I mean, 45 days between biopsy and surgery pathology, and it was already, to the lymph nodes. So I'm hoping that we are just now creating a generation in my family who is just relentless about going to the doctor early and often.
Wait, there's so many things there. Again, every time you talk, I'm just like, oh my God, because it's like love that you're creating a black male that is going to be concerned about health and be on top of things because that is we know that's rare, right? um and then you also mentioned screening, right? So it's really important to note here that black women do have dense breasts. You do need to get better screening. You do need to get 3D mammography. And then Dr. Candice can give you more information than I did, but I learned that it's mammography, and then depending on then your breast density, you can either get an ultrasound or MRI depending on how dense they are. The more dense you lean
Absolutely.
towards the MRI. And the way that someone described it recently was that this the better screening technology. It's like looking for, or if you just get like a 2D mammogram, it's like looking for a polar bear in a snowstorm,
Mhm.
right? Versus like when it gets better, when the screening gets better, like you get the right screening for your density, then you were looking for a polar bear and some grass, right? And it's a
Absolutely.
lot easier to see. um that's just someone described it. I was like, oh, that was a great analogy. I'm gonna like put a pin in that. But yeah, I think that that's really, really important. And as you tell your story, for those of us who are looking for the information on how to navigate their breast health journey, it's important to note those moments.
Mhm.
Yeah. So What else? I'm like, there's so many things I think you guys do. So what does it look like for someone to, or actually, how did you, Lucretia, how did you find Bright Spot?
My cancer center, and I talk about this a lot too, especially within our support group, because sometimes we get moms in even the Bright Spot support group who don't realize that there's a cancer center in their area. And my cancer center was actually recommended to me from my oncologist, and they provided resources for your family and yourself for mental health support groups. They actually provided liquid nutrition, bras, um, prosthetics. When you lose your hair, the beanies. It was just an amazing place that I could go. They even did transportation on days where you couldn't drive yourself. They had support there. And my cancer center is who said, hey, check out this group called Bright Spot. And my friends always tease me because no matter what I'm going through in life, I'm finding support. I am someone who does not like to go it alone. And so when I heard about Bright Spot, I sent in a request, and I asked for, the books. And probably within a week or so, I had the materials in hand. And that's how, like, I found them very quickly. And even before my surgery, I already had materials and I had things that I could start doing to prepare my son for this shift. And I actually took time off from work before surgery I took like 2 weeks off before surgery to give myself a chance to enjoy my body before it became a science experiment. So I had those 2 weeks where my son's in daycare and I could study, you know, so much to learn. My doctor gave me a big book after diagnosis, and I just read and studied and Googled and this and that so that I could understand what was coming. And I had really good friends who had also had cancer prior to me who gave me great advice like, hey, my day job at the time, and we'll talk about that if you would like. But my day job at the time was analyzing data and studying human behavior. And one of my good friends said, hey, this is a time we're going to be making really big decisions with less than 20% of the information. And you got to make it quick and you can't be on the fence. And there's going to be a million people around you who are going to say they know for sure what you should do, but you are going to be in the room when they're saying, hey, you want chemo or radiation or surgery or all three, or do you want to try this experimental thing? Do you like, you are going to be the one who has to say yes, no, when, where, who's helping, who's supporting. And so there was just a really big shift that happened in myself, around, you know, education, not just for my son, but for myself so that I could speak intelligently about it. And so having my cancer service center provide me with Bright Spot, as well as, all the other things they gave me, liquid nutrition, who knew you couldn't get anything in. And I'm someone who loves to eat. So that was quite a unique experience. But, the Cancer Service Center and my oncologist and radiation oncologist, and my breast surgeon, they were really big on giving me things to prepare myself and my family. And one of those things was Bright Spot, and it happened really fast. So that was huge, because I don't know if I hadn't got Bright Spot's information before my surgery, I could imagine that my son would have just had much harder time with everything. Yeah.
I mean, we didn't even really talk about the fact that like you're also postpartum. You're also
Yes.
like breastfeeding is really hard,
Perimenopause.
right? Like breastfeeding is really, really hard, right? Ending that, starting that, whether you can do it or not, right? That's really, really hard.
Mhm.
And um, And yeah, so like that, what
The
an
early
interesting time
days
in
of
your life, because
school.
also your boobs are also changing so much during all of the whole pregnancy journey and all of that. So like having to advocate for something you don't know if it's normal or not, right?
Mhm.
Because you're like, is this
Mhm.
normal? Like, should my boobs stop leaking? You're like, what's going on here? So
Yeah.
it's just like a really hard thing to navigate because you don't know if it's normal or not half the time,
Yeah.
or like what if this is something that it would happen, because pregnancy is like, or like babies and fertility, it's like all this you think you know as things and you really you don't know anything.
And
And
you can
so
find the answer.
it's just already such a hard time to like just because it's really easy to be like, oh, that's probably normal, and it wasn't, right? And so for you to know that and advocate, and also knowing that without Bright Spot, where your son might be, like that's always a great way to like understand like the value of something.
Mhm.
And so that's great to hear. And so hey, they'd love to hear more from you too about like what that means to even hear
Yeah.
them, right?
I mean, I love that. Like, I think especially because, after my own cancer journey, this was like a gap that I saw and tried to fill with Bright Spot. And so to hear that it, made that difference for you. I mean, I know, look, we've talked before, and so I know, but like still, like it just is so incredible to hear that. Um, Something similar that I had heard was a social worker that we work with was just kind of telling me like an anecdote where she said that whenever she has a patient that's like going to like Google their diagnosis and like they're about to like go down the doctor Google rabbit hole, she's like, just go to Bright Spot, like just go to their website instead.
Mhm.
And that, I mean, it was the same, it was just like to feel like you're able to provide like good information, that's not going to be scary, but it's like real. That's that's what we're trying to do. We have a bunch of resources about how to talk to your kids at different ages. So for babies, like how do you maintain routine when so much is changing in your life? Like that is going to help your baby to better navigate your cancer diagnosis. If you have a toddler, ways to specifically like talk to them or to help them understand changes to your body, whether or not it's changes to your body's routines, like bathroom or hair loss or, using a wheelchair, whatever it might be, an ostomy, all of those things, kind of going up in ages to help parents to really just have a little bit more information, tools that they can use, and also just recognizing that every parent knows their kid the best. And like that's,
Yeah.
so like giving information that you can read and say, okay, like this is what I'm going to take from this, is that's what we're there for. We do a bunch of educational webinars that are also on our website. And something that you said before, Lucria, about just about your parents, something that we've been hearing more and more and more is just how do adult patients with children navigate that relationship to their aging parents. Sometimes they're caring for their aging parents and their children and have cancer, and just like all of these, just there's just so much when you're a young adult and you've been diagnosed, and you have little kids. So all of these things we're kind of trying to approach from the lens of being a parent with cancer.
Mhm.
And then I also saw that you have different boxes that are available too. There's like a postpartum box and
Oh
an
yeah,
art
we also
box.
off yeah. So the Bright Box is the art box that I mentioned, and we also do offer a postpartum box. So you can sign up for that on the website. So if you are diagnosed while pregnant, or your partner is diagnosed while they're pregnant, and or if your partner is diagnosed and you're pregnant, you can sign up for a box on our website, and that just comes with kind of just like teas and just like things to make you feel like a little bit held during an extremely stressful time. And then the Bright Box is an art box. And so we have 3 art projects in there. And like I mentioned, there's actually nothing like cancery in there. It's just point of connection. We know that that is good for the parent with cancer. We know that that's good for the kid. It's just good to connect when so much is going on. We also have like other kinds of activities just to help spark conversation, similar to the books. We offer coloring pages. And so it might just be a coloring page, with a character that has like a bald head, or, um, you know, a, a I don't know, I think it's like a panda that is getting an x-ray, just like to kind of start to have conversations with your child about some of the changes that you might be experiencing, some of the types of appointments that they might be hearing about in the background. Like maybe you have a scan coming up and you want to just like make sure that they understand what that is. Or they might have questions about, how do they know? How does a doctor know X, Y, and Z? And so these are just like, ways, just tools to help a parent kind of continue the conversation. Everybody loves to color. So it's just sort of like an easy thing that you can do, kind of like, you can have like hard conversations with like a teenager when you're driving. Like when catch them off guard a little bit, but it's kind of a similar thing is that you don't have to be sitting on the couch and like locked eyes to have a hard conversation. You could be coloring together too.
Haley, I have not spoke enough about the support group calls either. Being on the phone with other people experiencing the diagnosis through the treatment through survivorship who are also parenting, it was like the world really changed for me when I said, oh no, I have cancer. Everybody reacts differently to the strong person being sick, right? And so your spaces where you can just be the person with cancer really shift. And my support cause, which I still religiously attend, became a space where I could say the thing you're not supposed to say.
Mm-hmm.
And it became like there are people from those groups that like my very first group, I met a woman who lived in a whole different part of the country, and we became fast friends. And she was like a week ahead of me in treatment.
Mm-hmm.
We had different types of breast cancer, but we literally went through it together. Like
awesome.
We would talk offline. We would also connect during group. And her kids were a little bit older, and she had the double mastectomy, and she had boys, and she went through why would you get reconstruction? That is such a cosmetic thing. And, we could support each other with like, you have to tell your sons, this is not, you didn't get a boob job. You got an amputation, and you're replacing a part of your body that is functional. It's not an ornament. It's not decoration, and so it's the support group became the space where I realized I wasn't crazy too, because the doctors sometimes will overlook things because each person is specialist. And that was a world that I wasn't used to either. You're so used to your primary care who generally takes care of everything. And now you're dealing with specialists who are like, I don't see any cancer. And I see all this other stuff, but the cancer's not there, so you're good. I'm not concerned. That became the phrase I hate. And then I was Dr. Thompson. That phrase does not give anyone comfort. It's like, yeah, I see this little fluid on your lung, but I don't see any cancer, so I'm not concerned. Well, who is? So it just became the space where I could say, in the moment, here's what's happening with my kid. Here's what's happening with the daycare, right? Because there's going to be days where it's your day and you woke up fatigued, or you woke up in pain or GI issues, and you're like, my kid's going to be late. How do I, enroll the daycare? And it was just so many moments on those calls where I felt seen, I felt heard, I felt safe to not blanket the fact that I really have cancer. I absolutely think about death. I remember one of the ladies on one of the groups, she taught us about, if your prognosis is good, that's great. But you should still have the conversation with your best friend that says, okay, you're his godmom, but what does that look like in real life when I'm not an old lady when something happens, right? When I'm young, like, she actually taught us, like, hey, ask your friends. Like, I want you to be the person that physically goes and sees him once a month. I want you to be the person who he calls when he's doing something on his homework that's confusing. I want you to be the person who talks to him about girls, but not you, girlfriend, because you don't. So it's just it like that level of sharing and connection and education is happening on those 90-minute calls once or twice a month, depending on how many groups you're in. But
Yeah,
it changes your whole world.
I love that.
I
I think that's
am.
amazing. And I feel like that sort of touches on another aspect of being diagnosed young with cancer is and having children is that's when like I don't know your situation, Lakria, but that's when sometimes relationships fall apart, especially with like your partner or significant other. And I feel like those sort of support groups are really needed. Because
Hmm.
I can't count the number of times that I've seen someone who's gone through cancer and like they're going through a divorce while they have cancer and while they have young
Hmm.
children. Like I have multiple women like that right now, and it's just so beyond disheartening.
Mhm.
And I think like support groups in those situations, especially when you have young children, is really needed.
It
Yeah,
is.
I went to a cancer con a couple weeks ago,
Oh,
and
yeah.
yeah, and I like it was a great conference. It's AYA cancers. And so I met some young black women who had breasts, but like across the board. And it was interesting for me because, and I learned so much. It was interesting for me because in breast cancer world where I spend my time, a lot of the cancers are like young is still uh it's like post puberty, right? But
Mhm.
for this, these were people who had cancer from childhood, right? And so they've been dealing with this their whole lives. And again, that conversation with their parents was different because
Hmm.
their parents would do anything to save them. And now they have the aftermath of like a lot of experimental things and like and dealing with that. And so it's just a really interesting. But being in that space, you saw how like amazing it is when you find people who can relate to you.
Hmm.
And so like that it felt like one massive support group in a beautiful way. Because again, there's something really, really magical about being able to speak to people who are in your unique situation, whether that be cancer, whether it be you found it when you had a 2 year old, like, and like the more minute you can get on those details and find are having the same experience, if there's just nothing like it. And so I'm sure that support group is great. And look, you to join one of our support groups too. We have a support group for young survivors as well. So young Black survivors of breast cancer. So definitely come and join. I know they've been having some of those conversations about relationships. And I think recently they talked about how expensive everything is and how they manage that because like that's a whole different ball game when you think about I'm young and I don't have my career yet. Like I'm still figuring it out. And I now want to like pay for IVF because I know I want to freeze my eggs so that I need to do that now,
Hmm.
and so things like that just become such a big deal. Well, yeah, Haley, you did mention that you guys had some financial resources as well.
Yeah.
What does that look like?
Yeah, so we have a financial grant called a Break Grant, and it's a $500 grant that we call it barrier free because you don't need to submit any receipts. We trust the families that receive the grant to use the money in the ways that the families need. It's currently paused, but we do, well, our sort of general grant is paused, but for any Bay Area, and especially Candace, if you have any patients that this could apply to, please send them our way. If you are a Bay Area breast cancer patient, so if you live in one of the seven Bay Area counties and are a breast cancer patient who is raising a child 0 to 6 years old, we do currently have a grant open. And that information is on our website.
Awesome, which I did put on the Black Doctor site
Okay,
so
awesome.
everyone
Cool.
can access it.
Yeah,
Cool.
I think our
Yeah.
nurse navigators are dialed in to Bright
Okay.
Spot, so, but I will definitely keep that in mind for
Yeah.
Probably.
Because that grant is open now, and one of the things that's great about it is that I can move that money pretty fast for patients that need it. We want to, it's an emergency grant. It's $500, but if you are diagnosed with cancer and you have a little kid, um, you know, you can use that money however your family needs it, whether it is copays or making sure that you know kids have clothes, whatever, whatever it is, that is a anyway, we have that service.
That's amazing.
That's awesome. Yeah.
I would like to talk a little bit about what Dr. Thompson just shared about your family changing.
Hmm.
Um, One of the things that gets very clear to you is what support looks like in a year where you're going through cancer diagnosis and treatment. And in the last 18 months, I have really found out like who loves me. Like there were times where I had to be like, okay, friends, like you guys can't all fly in on the same day. Like I had to have like a calendar, like, okay, like not a meal train, I had a visitor train because there were people from every part of my life who was like, you mean so much to me. What can I do to just soften this in any way, even if it's just sitting in the room with you, or being there for you. But it then also highlights the part of your world that isn't supportive. And so, I've come into a place where now my company released me after 20 years, because they're downsizing, but you're taking your leave of absence because the treatment is so grueling. The mental aspect of it is really tough. And going through chemopause is very different than menopause
Yeah.
because you get no ramp. You're just boom, estrogen
Mhm.
over. And estrogen is a super power in your body, and you don't know it until you don't have it. Um, and I'm blessed that I was done having kids, but I can't imagine the young women making those choices to do a treatment that has a margin of error, um, and knowing that it is going to affect their ability to be a parent, especially those of us who suffered with infertility. But I came out of treatment with, now I'm living in a multi generational home, and my spouse is not here. And I'm also now not at a job that I spent 20, almost 21 years, um, building their businesses. And, they were in a period where they needed to downsize, and you're someone who's now considered disabled. When you look at applications, they list cancer as a disability. So you're not yourself. You didn't get to parent the way you wanted to. It takes a lot. Your body is a stranger, and you just live life wondering, is this the last round of this? So it is interesting that you bring that up because I hear a lot of cancer survivors who are also now, you know, living without their careers because you had to take the time
Mm.
and the world had to keep moving, and you're a casualty and your family dynamic shifts. So, it's so important to have groups like Bright Spot because I wasn't alone in it. I wasn't alone when my husband was making the stupid comments, and I could go to Bright Spot and yap about it and, talk to other women who were experiencing, you know, the light being shown on a broken relationship, or a company who, they speak very highly about their policies, and then you're disposable because you're now living with the disability. So, I'm glad that you brought light to that. because it is a risk that you take. You know, when you say, hey, I'm going to aggressively treat my cancer and I'm going to support my body and I'm going to prioritize motherhood. So if I'm going to have a few hours a day where I feel good, or a few days a week where I feel good, I'm going to give that to my kid.
Yeah.
And I'm going to take the FMLA, the time away. So sorry to get
No,
emotional.
I mean, like, thank you for your vulnerability. I think that is, it's so important for people to see that. It's so
Yeah.
important to understand that what you're dealing with is so many different versions and layers of grief, right? For your old life, for your, like, or like your old body, and it's like all of the things. And so,
Mm-hmm.
like, take the time you need, and definitely take the time you have. I'm sure the time you need is more than what we have, right? But um like, be easy on yourself, which I know is easier said than done.
Yeah.
But because it's so, there's just a lot of grief in this moment and in this process. And
Mm-hmm.
then what we're talking about is explaining that to other people and kids, and like
Mm-hmm.
how that goes, right? And so it seems like you're doing a really good job handling it all. Not that, again, it's not easy work, and you didn't sign up for it, you know what I mean? Like, it came to you.
Mm-hmm.
um and so, you know just know that you're crushing it. It's, and I'm like happy to meet you now, and like, make sure you're a part of the Tech family too, because we um we love the community and no one fights alone. It's so important to have people along this way. Um, Even people that just eat raspberries.
It's so
So
cute.
cute.
um, but yeah, so this has been great, great, great. Well, we'll have to wrap up soon. So any last comments, anything that, how can people find you? Is there anything you didn't share? Every show it's like, gosh, we need another one. We need to continue this, but please feel free to share anything that's on your mind.
I was just going to say, just to reiterate, our website is brightspotnetwork.org, and you can follow us on Instagram at Brightspot. And then I did just want to share one exciting program that we have going on right now, which is a partnership with Triage Cancer, which is specifically for parents who are, it's called Beyond Diagnosis, Parents Navigating Metastatic Cancer. And there's four parts to the program. One is a webinar series that starts on June 9th. And the first webinar is about talking to your kids about advanced cancer. And then there's three additional webinars about, finances and legal stuff, as well as more parenting with metastatic cancer. We also are offering, Brightspot has family resource navigation, which is basically parent patient navigation with a like lens towards a family focus. And so part of the program is family resource navigation alongside Triage Cancer's legal and financial program. We also co-created a practical guide for parenting with cancer. And then you also, as part of the program, can receive Bright Books, part of the Bright Reads program, as well as a Bright Box. And so information is on our website, but we're really excited about that and just wanted to throw in a little shout out for it, a little plug.
Well, thank you all so much. Thank you, Haley, for being here, and thank you, Lakria, so much for sharing your story and your vulnerability. I think this is really going to help other people who are in your situation, and you've really inspired so many others. So thank you.
Thanks for having me.
Yeah, no, we can't thank you guys enough. I think that we're so happy to be able to bring on partners and share the amazing resources. I love Triage Cancer, love what they're doing as well. So that's great partnership there. And so if anyone's looking for new resources, please hit up Bright Spot Network. Please hit up us. Please hit up Triage Cancer. Like, there's just so many amazing things And Lakria, keep telling your story. I think that that's going to allow for so many other people to unlock their vulnerability. And so thank you for doing that today. And I hope that we can do more in the future.
Okay.
Yeah.
Yay.
So this is Pink Table Talk. Thank you to all of our sponsors of Pink Table Talk, and to Black Doctor, and we look forward to seeing you guys next month for a pride moment of some sort.
Yeah.
And so we are, yeah, happy Mother's Day, and we'll see you guys next month. Okay. Thanks.